gland. Mammary gland. Situation and relations. Breasts are rudimentary in males. In non-lactating females, breast mainly consists of fatty tissue with 50 to 20 granular lobes. Situation. Mammary gland is embedded in the superficial fascia of pectoral region. Extent. The base of the mammary gland extends from second to the sixth ribs vertically. Horizontally, that is in transverse. The base extends from the lateral margin of the sternum, also known as the sternal margin, to the mid-axial line. Parts. The broad base of the mammary gland is in contact with the chest wall. Its pointed apex bears the nipple. The breast is divided into 4 quadrants, that is upper medial, upper lateral, and lower lateral. A projection of granular tissue from the upper lateral quadrant of the breast is known axillary tail of Spence. This axillary tail of Spence extends into the axilla through an opening in the axillary fascia known as foramen of Langer. Deep relations. Deep relations are relations of base or deep surface of breast. Base of the breast lies on pectoral fascia, which is nothing but deep fascia covering pectoralis major muscle. Deep to the pectoral fascia, there are 3 muscles. Pectoralis major muscle is in contact with the greater part of the base. Serratus anterior muscle is related to the superolateral part of the base. Aponeurosis of external oblique muscle of the abdomen is related to inferior part of the base. Between the base and pectoral fascia, there is a space filled with loose areolar tissue with fat. This space is known as retromammary space. The retromammary space allows some degree of mobility of the breast. Structure. Structure. The structure of the breast can be studied under the subheading skin, parenchyma, and the stroma. Skin. Skin covers the entire mammary gland. It presents the following features. Nipple. Cone-shaped projection of the skin of the breast is called nipple. Nipple is situated just below the center of the breast. Its level corresponds with the 4th intercostal space, about 10 cm from the midline. However, you should remember that the position of the nipple varies depending upon the shape and firmness of the breast. The nipple is pierced by 50 to 20 lactiferous ducts. Structurally, nipple consists of smooth muscle fibers which are arranged in circular and longitudinal fashion. The circular muscle fibers on contraction make the nipple stiff, or in other words, circular muscle fibers erect the nipple, whereas contraction of the longitudinal muscle fibers make the nipple flat. Nipple also contains few modified sweat and sebaceous glands which lubricates the nipple and prevents it from drying. Nipple is the most sensitive part of the skin of mammary gland because it is rich in nerve supply. At the time of birth or few days after birth, the nipple everts at the side of primitive mammary pit. Areola. Areola is the circular pigmented area of the skin around the base of the nipple. It is rich in modified sebaceous glands, especially in its outer margin. These modified sebaceous glands enlarge during pregnancy and lactation, when they are called as tubercles of Montgomery. Their secretions are rich in oil content. They lubricate both areola and nipple. Skin of the areola and nipple are devoid of hair, and there is no subcutaneous fat. Below the areola lies 50 to 20 lactiferous sinus which stores milk. However, recent observations have shown that amount of milk stored in lactiferous sinus is much less when compared to the alveoli of the mammary gland. Parenchyma. Mammary gland is compound tubulo, alveolar in nature. That is, it contains both tubular and alveolar secretory elements. Each mammary gland contains 50 to 20 lobes. Lobes are radially arranged. Each lobe contains numerous alveoli arranged in the form of grapes and is drained by lactiferous duct. These 15 to 20 lactiferous ducts converge towards the areola, where each duct presents a dilation known as lactiferous sinus. Finally, they converge towards the nipple and open by piercing the skin of the nipple. The epithelium of the alveoli varies depending upon the activity of the mammary gland. Alveoli are lined by simple cuboidal epithelium in the resting phase. When they are active during lactation, they are lined by simple columnar epithelium. Smaller lactiferous ducts are lined by simple columnar epithelium. Larger ones are lined by stratified columnar epithelium, which contains 2 or more layers of cells. The terminal part of the lactiferous ducts is lined by stratified squamous keratinized epithelium. The alveoli and the ducts are surrounded by specialized contractive cells known as myoepitheliocytes. When they contract, they facilitate the passage of milk from alveoli into the ducts and along the ducts. Stroma. Stroma is the connective tissue element of the mammary gland which forms supportive framework. It is partly fibrous and partly fatty. The fibrous part of the stroma forms septa, which attaches gland with skin and pectoral fascia. This septa is known as ligament of Cooper. The main bulk of the gland is formed by adipose tissue or fat tissue, which is distributed all over the breast except beneath the areola and nipple. Innervation and vasculature. Blood supply. Now coming to the vasculature of the mammary gland. First, we will look at the arteries that supply the mammary gland. Arteries. The mammary gland is highly vascular. It is supplied by branches of the following arteries: perforating branches of internal thoracic artery, a branch of subclavian artery. Branches of axillary artery, namely superior thoracic artery, thoracoacromial artery, lateral thoracic artery. Lateral branches of second and fourth intercostal artery. The branches of these arteries converge on the anterior surface of breast. Compared to anterior surface, posterior surface is relatively avascular. Veins. The veins draining the breast parallel to the arteries The superficial and deep veins drain into internal thoracic, axillary, and posterior intercostal veins. The deeper veins drain into axillary and posterior intercostal veins. Veins draining the breast communicate with the vertebral venous plexus of veins. Through these communications, cancer can spread to the vertebrae and to the brain. Nerve supply. Innervation of the breast is by the anterior and lateral cutaneous branches of 2nd to 6th intercostal nerves. The nipple is innervated by the 4th intercostal nerves. The secretions of the mammary gland is controlled by hormones like prolactin and oxytocin secreted by the pituitary gland. Lymphatic drainage. Lymphatic drainage of breast is of utmost importance because cancer of breast spreads mainly by lymphatic route. The lymph vessels of the breast are grouped into superficial and deep sets. These lymphatic vessels drain into lymph nodes. Lymph nodes. Lymph from the mammary gland drains into lymph nodes situated in the axilla known as axillary lymph nodes. There are 5 groups of axillary lymph nodes: anterior, posterior, lateral, central, and apical group. Most of the lymph from breast drains into anterior group of lymph nodes, also known as pectoral lymph nodes. The lymph from the breast also drains into posterior, lateral, central, and apical, either directly or indirectly. Parasternal nodes, also called as internal mammary nodes, situated along the internal thoracic vessels. Supraclavicular nodes, interpectoral or Rotter's nodes, cephalic deltopectoral nodes. Posterior intercostal nodes, subdiaphragmatic and subperitoneal lymph plexus also receive small amount of lymphatic fluid from the breast. Superficial set of lymphatic vessels drain into axillary lymph nodes. Parasternal node, the supraclavicular nodes, and deltopectoral nodes. However, a few lymphatics cross over to communicate with the lymphatics of opposite breast. This acts as a route for spread of cancer from one breast to other. Deep set of lymphatic vessels. It drains parenchyma, subareolar plexus of Sapé. Subareolar plexus of Sapé drains skin of nipple and areola. Both parenchymal plexus and subareolar plexus drains mainly into anterior group of axillary lymph nodes. Few drain into Rotter's nodes and others to the posterior and lateral group of axillary nodes. From these axillary nodes, lymph passes to the central nodes and finally drains into apical group of axillary lymph nodes. A few vessels from the base communicate via the rectus sheath on the anterior abdominal wall with the subdiaphragmatic and subperitoneal lymph plexus. This acts as a channel for the spread of carcinoma of breast into the abdominal region. It is important to remember that 75% of the lymph from the breast drains into the axillary lymph nodes, 20% into parasternal nodes, and 5% into posterior intercostal nodes. Mammary gland.